There was a conversation with your physician about what orders can and cannot be done here, and he still ordered the same medications.
He is my doctor. My doctor has autonomy over my care. I have never, ever fallen into a coma. I've never been overly sedated. I've never had any problems with my medication. I am here for treatment so that I do not have to be admitted.
Okay.
I have never, ever been disrespectful, although I have been disrespected by staff. And I'm quite sure that if my doctor was told that he could not give me the medications that he has been giving me for 20 years, we would have definitely had a meeting about it. Him, my mother, and the administration, and anybody else that needed to be called down here. No, ma'am.
The conversation did happen,
Well,
but he said okay and went on. Now he has written the same orders, and the way he has written the orders
what is
are
wrong
up
with
to interpretation. It's ordered every 2 hours as needed. Now, as needed is up to
the
nursing
patient
discretion. No, it's not.
So
It's
does
up
it need
to
to be
safety.
changed to something else?
I can call Dr. Hamburg and have him change to every 4 hours and have it described. This is what she can get every 4 hours. This is so
I'm
that
a
we stagger
sickle
those drugs.
cell
You can have something
patient.
every 2 hours. You can't have everything every 2
No,
hours.
my Ativan I have every 4 hours. I start off with all of them together. My Ativan is every 4 hours.
Okay.
My pain medication, if needed, will be every 2 hours. My Benadryl is staggered, 25, 50, 25, 50, which, if needed, I will request and I will stagger 25, 50.
Okay. We'll call Dr. Hamburg and get some clarification on the orders, because getting both the Benadryl at those doses, Dilaudid and Ativan
It's
all
not
at the same
Dilaudid.
time.
It's morphine.
Morphine.
I have
Opioid-
built up a tolerance. I have been taking morphine since I was 6 months old. I have been in the hospital on average 3 times a year, damn near my entire life, excuse my language. I have a high tolerance for pain, and therefore the medications I need to control said pain is set at a high tolerance as well. There
Okay.
has never been a problem, ever. And please, we can download all 880 pages of my chart and read them together. There has never been a problem with me in these medications, except for the one time a PCA malfunction. Malfunction, not the nurse's fault, the machine's fault, and gave me 18 milligrams of morphine in less than 5 minutes. And even then, I was okay. What I see this as being is really an overstepping and a misuse of federal policy about opioid usage, and it's not right.
Okay.
I'm a sickle cell patient. I'm in pain. I have an infection. I have requested my medications to be given to me as they are written by my doctor. I have told you how I stagger the medications throughout. And if you want to call and clarify with him as to how the rest of the day will go, we may all do that. But I would really like to have the Benadryl, Ativan, and morphine right now, please.
Okay. You won't get all 3 of those right now.
Why? This is
Because
on
the definition of those 3 medicines together is defined as moderate sedation. You
But
have gotten them in the past.
But I've never been moderately sedated by them. I've never even, I don't even go to sleep.
Okay.
This is just to control my pain. The pain needs to be controlled. The Benadryl controls the itching. I have very sensitive skin. I start scratching. The site gets infected. I'm here for extra amount of time. That's not okay. And the Ativan is to simply calm me down so that hopefully 3 hours from now, I can actually go to sleep.
Okay. To decrease the delay in the time, we can go ahead and start your hydration, because your hydration is for 6 hours while we call Dr. Hamburger and clarify. Okay. In the meantime, I'll pull the policy,
Please
the
do.
moderate sedation policy.
Please do, and please call him so I can be medicated.
We're going to go ahead and give you your antibiotic and start your hydration. And we could give you one of those medications. Which one would you like to have right now? And then we will clarify at what instance,
Do you mind if I connect you? Is that okay?
That's fine, thank you very
what
much.
intervals we can proceed with the rest.
I am going. Calm down. I cannot be admitted. I cannot be admitted. I'm gonna get upset. Well, we'll start with the morphine.
Okay.
I would like you to call my doctor immediately. I then would like to speak to administration.
Okay. The reason I'm here is because our associate director is in a meeting. She will be very happy to come talk to you. In the meantime, I'll have the policy for her, and we will be calling Dr. Hamburg right now.
Please do.
Okay.
And may I have your card?
I'll be over there.
Thank you so much.
You got the
Except for actually
morphine. I'm going to get policy and call Dr. Hamburg.
Okay. Alright, this one is your antibiotic, okay?
Mm-hmm. Now, why is the antibiotic being pushed?
Because there's a saline shortage. Mm-hmm.
But even if I'm here for, is it not compatible with my other medication?
It's compatible with this, but just because of the saline shortage, we're not putting it in a bag anymore. We just push
But I
it.
mean, but we're giving me the whole bag.
Of hydration?
Yeah.
Yeah.
So couldn't we have just put it in there? It's just a question.
Oh, I mean, I guess, but
It's just a
pharmacy has
question.
to have it pushed. So, because that's going to go over,
6 hours.
this bag is 4, and then this one, half of it would take about 2 hours, so,
Right.
yeah. I don't think I've ever given ceftriaxone over 4 hours.
I'm
So.
just asking.
Yeah, I guess technically you could, but at the speed it's going, it would be too slow. Yeah,
Would
4
it
hours is
separate?
too long.
Would it separate? Would it no longer be potent?
I don't know the chemistry and the pharmacology of this. I know sometimes we give it it's in a bag, we'll give it over like 30 minutes. But there are some drugs, I'm not saying this is one of them, there are some drugs that you've got to give in a certain amount of time because the half-life is short. So if you take too long, by the time you get the whole dose, it's already...
Right.
Yeah.
Got
I
it.
don't know if that's it, but I know there are some drugs like that that exist. And your pain level right now?
Well, 7, now it's 9.
This is your morphine.
Thank you. I'm sorry, she's a pharmacist. What did she do?
She used to be a manager. She is our educator now. She knows all the policies of the hospital. She's our go-to person for all things policy.
And so who called her?
We did. Because the doses of everything were just high, and we looked at the treatment plan from prior, and it looks like you were getting them all at the same time every 2 hours. So we just called to make sure that that was okay. So.
And from looking at the chart, did it not say that it was tolerated? Did you see that there were problems?
There were no problems, no.
So,
But if it's something that, like, if the doses are too high, even if there was no
What
problem
is considered
before.
too high for a sickle cell patient and a patient that's built
Good
tolerance?
question. Yeah, I get you've got tolerance, but I just needed approval. We needed approval to give everything all at the same time, because it's not high for you maybe, but it's high for
But
our
I'm
policy.
the only one that matters. I'm the patient.
Well, there are policies in place to protect everybody, so we have to get an okay to bypass the policies, which is why we call it AND. So I understand that you've gotten them before, no problem, and I believe you.
No, I don't think that you all really do understand the amount of emotional, mental stress that comes when somebody comes in and says to you that you can't be given your medication the way that it is written by a doctor that has cared for you for 20 years and then turns around and tells you that your 41 years of personal experience and the 120 years of communal memory and experiences you have from your family and friends is not good enough, and the fact that you've never ever been sedated except for when the PCA wilded out. But
that's not what we're saying. We're not saying we don't believe you or that you don't know how to take care of yourself.
The patient, no, but I'm being compared to and put into a group of patients and compared to a group of patients that other patients, another person might not be able to handle this, when yet and still 30 years of charts say
we're not
she
comparing
can.
you. It's just a safety measure that we take, and if it's okay with, once you talk to the doctor, if it's okay with him and he's made aware of it again, that these are our policies, and that's one thing, but we just have to make sure that it's okay.
May I have the policy, please?
Yeah, she's getting it. I'll be back. Okay?
Thank you very much. And I appreciate your help.
Yeah.